Maybe just tell them what we found when I was poking on your hip there.
Yeah, actually, doctor was trying to press on my hip, but I did not feel the pain. Initially, it was there.
Hi there, my name is John Clark. I'm a chiropractor here at Dr. Spine, and we had a brand new patient today. This is Arun. He's 31 years old, and he's had back pain, significant back pain for 20 days. And as you can see, he had an MRI, and hopefully you can see that. He has a very large herniated disc. So he went to an orthopedic surgeon, and they said, well, your options are medication or injections, and if that doesn't work, you'll probably need surgery. And he had the classic sciatica symptoms, right? You had pain down your left leg.
Yes.
All right. But what's really interesting is there's actually a problem in his neck as well, but he doesn't have any neck symptoms. So that shows you that you can have a problem that doesn't necessarily cause a symptom. And then, as you'll find out in a minute, he does have a problem here, but that is actually not causing his pain, even though it's a bad disc problem. So if we look at this view here, there is a bulging disc. This is the left side where he's symptomatic, but the right side is actually worse. See how that is a thinner canal there? So this is where the nerve might be getting pinched. But when we go one slice higher, there is an opening for the nerve to get through. You can actually see the nerve right there. So as long as there's a way for the nerve to get through, then the nerve is not being pinched. So then the question is, what's causing the pain, right?
Yes.
So we just did an examination, and Arun, maybe just tell them what we found when I was poking on your hip there.
Yeah, actually, doctor was trying to press on my hip, but I did not feel the pain. Initially, it was there, but after releasing that muscle, pain got relieved to almost to the tune of 20%.
Right, so after one appointment, he's already 20% better, and he was told just last week that he might need surgery. So he's already a little better. So we're going to get him better with another treatment and another treatment. So 40%, 60, 80, 100. But a moment ago, we pressed on the muscle on his hip, and that recreated the pain down his leg. So I want to explain what that's all about, because I see it very, very often. So just because you have leg pain, it might seem like you have sciatica, but it isn't true sciatica. So hopefully you can see this here in my book. So this is a muscle called the gluteus minimus. So when there's a trigger point, which is a tight muscle, when there's a trigger point here, it can send pain down the leg. So this is almost exactly what you were feeling.
Yes.
He had pain to his knee, he didn't get to the foot, but it was very similar to this picture. But when I pressed here, the pain went down his leg. So that tells me that he has a muscle problem and also a joint problem here, but mostly a muscle problem causing this pain. So the lesson learned is, if you have sciatica, if you've been told you have sciatica, there's a very good chance you don't have sciatica. So if you've been told you might need surgery, like he was told, you owe it to yourself to get a second opinion. So come in and see me. We'll do the same examination we just did for Arun. And hopefully in your case, we can find a trigger point or a stiff joint that is causing your pain. So don't worry, you don't have to have surgery. We can prevent surgery. I've prevented surgery hundreds of times with other patients. We do a handful of treatments for Arun, the muscle will relax, the joints will start to move properly, and then his pain is going to go away. So maybe in a few treatments we'll do a follow-up video. But give us a call. Again, it's Dr. Spine, Chiropractic Clinic in Bangalore.